When we focus on nutritional deficiency, anemia can be treated using various methods. First would be to encourage patient to take iron-rich diet. This diet can be obtained either from a plant-based or an animal base. Plant-based diets are, for example, green leaf vegetables, broccoli, apricots. Animal-based diets are, for example, chicken, you have red meat, shellfish, and so forth. At the same time, iron cannot be absorbed by itself. It requires the help of vitamin C. So I would encourage all patients after consuming an iron-rich diet to consume food or fruits that are rich with vitamin C as well. At the same time, there are a couple of drinks that basically blocks the absorption of iron, for example, tea and coffee. So I would suggest if you would like to consume tea and coffee, maybe give a space of 1 to 3 hours before you take your iron-rich diet. Now, you also have other modalities to increase iron, for example, taking iron tablets. But unfortunately, about 40 to 50% of the patients tend to have some form of GI side effects. For example, patients can have bloatedness, they can have constipation, and to a certain extent, they can feel a bit nauseated. The third modality to correct nutritional deficiency of anemia is to give IV iron or intravenous iron, where there are newer generations of IV formulations that can be given very safely in a daycare setting. We are able to increase the iron within an hour to 3 hours, which usually takes long with the diet and oral intake. Now, in terms of patients having vitamin B12 deficiency or folate deficiency, they can either increase their diet that are rich in B12 as well as folate, or they can consume tablets that has got B12 and also folate. Normally, what I will tell patients is if they have got mild symptoms and mild counts, then I will just ask them to go on the diet and the oral intake. If they have got more symptoms and their counts are very low, then I will encourage them to take IV iron. The treatment that I described with regards to nutritional deficiency anemia has to be sustained throughout the patient's